Oh my God. I think everybody might have heard that. Good morning, everybody. We're just going to let everybody in. There's quite a lot of people booked on this webinar, so it might just take a minute or two for everybody to join. Just while everybody's joining, just letting you know that we're recording this webinar for people who are not able to be here today. Okay, just hold on another minute. I've just seen your message, Mark Humble. You heard about me hot flush. I like to share. Amy, how many were you up to?
124.
Okay. What time are we on? 10:33. We'll wait one more minute and then we'll start. I hope it's sunny where everybody is. It's sunny here, even though the weather forecast said it was going to rain. It's a nice day. I feel like we should be entertaining you whilst you wait. But I think if I burst into song, you wouldn't appreciate it. How many are we up to now, Amy?
129.
Okay. Shall we make a start? Rather than sing. Oh, go back to the beginning. Do you want to take it off, Amy, and then take it back to the beginning? That's it, thank you. Okay, so while we're doing that, welcome. Good morning, everybody. Welcome to this North East and North Cumbria LeDeR webinar. LeDeR, Learning from the Lives and Deaths of People with Learning Disability and Autistic People. We're expecting over 200 people on this webinar, so it's great. Obviously, there's lots and lots of interest to know what's going on, what our new arrangements are for LeDeR across the North East and North Cumbria. So we'll just do some introductions of the presenting team today. Obviously, we're not going to do introductions for everybody because we'll be here until 12 o'clock just to do that. So my name is Judith Thompson, and I manage the North Eastern Cumbria Learning Disability Network as part of the ICB. And I also am the strategic lead for LeDeR across the North East and North Cumbria. Amy?
Morning, everybody. My name's Amy Hockin. I support the coordination of LeDeR and provide business intelligence across the North East and North Cumbria, and I also am part of the Learning Disability Network.
Thank you, Amy. Glenn?
Morning, everyone. Glenn Beatty. I'm one of the reviewers within the centralised LeDeR team working across the ICB footprint.
Thank you, Glenn. And Kathy?
Hi everyone, I'm Kathy Peterson. I'm a GP and Strategic Clinical Lead for Mental Health, Learning Disability and Autism. Lovely to see you all.
And Julie?
Hi, I'm Julie Tucker. I am also part of the Learning Disability Network, and I'm going to be monitoring the chat and just helping keep an eye on things.
Thanks, Julie. So we are going to start very soon, but before we do that, I just wanted to ask you to use the Q&A button. So across the top of your bar of the webinar, there's a little icon that says Q&A, and rather than using the chat for questions, we're going to use the Q&A button for questions, because at the end of every section there's a Q&A section we will come to, and we'll pause, and Julie's going to monitor that Q&A for us, and then we'll answer as many questions as we can in that little break between different sections, and any that we can't answer or don't have time to answer today, we'll get the answers and we'll send those to you. So just a couple of housekeeping, just to keep us on track. Can you just, everybody, make sure that you're on mute? I've already said the webinar is going to be recorded, and we'll share the slides and the recording after the webinar. So I've already said as well, Q&A in the Q&A box, please, and we will follow up anything thereafter. So to start the webinar today, we're just going to remind people why LeDeR is a massively important programme of work, and we're going to show you a film. So we're going to show you, a lot of you will have already seen this film, but it's a film that we have made for our Learning and Sharing event a couple of years ago that the Twisting Ducks made for us, and it's called 24 Years of Life Worth Living. And the reason for this film in particular is that we know that people with learning disability and autistic people still die around about 24 years sooner than they should of things that could have been prevented or avoided. So this is a really brilliant film to remind us about what 24 years of life could and should look like for people with learning disability and autistic people. Thanks, Julie.
What shall we do today? 2 ticks, we'll be on our way. 4 reasons why to stay. What's in a number? Looking back to yesterday. Making plans and making hay. All our dreams along the way. What's in a number? Loving life. This is our time. Holding on to 24 years worth living. I'm proud of who I grew to be, of all the possibilities. I've been a star upon the screen. Did you see me? I wrote a book for you to read. I met the girl of my dreams. I found the friends I truly need. So can you see me? Loving life. This is our time. Holding on to 24 years worth living. 24 years, that's 1,248 weeks, or 288 months. That's 8,760 days. Well, I've sailed the seas, felt the ocean breeze, found a world out there that changed me. Made a family, built a home for 3, felt a love so big it shaved me. Look at you and me, we can live our dreams, making memories together, and you'll see we've got a lot to give. What did you do today? Did you while the time away? 24 hours in a day. What's in a number?
Thanks, Julie. Amy, we'll put the slides back up, please. So the way LeDeR operates across the North East and North Cumbria has changed, and we're going to use this webinar to share with you what the new working arrangements are. Okay, keep referring it to as our one system approach or one way of doing LeDeR. So what we're going to cover in this webinar is remind everybody what LeDeR is, share with you the one way of doing LeDeR across the North East and North Cumbria. We're going to share with you the governance and strategic leadership arrangements. And then we're going to share with you all of the new ways of working. So the roles and responsibilities of people that are very involved in the programme, the new panel arrangements, the new Learning into Action group, and the newly refreshed governance group. We're also going to share with you some of the learning from the ICB's Learning into Action, LeDeR annual report that's going to be published very soon, but I'll come on to that a bit later. And then lastly, we're going to share with you our plans for communication in the future, but also ask you what you need and what you would like so that you are always up to date with what we're learning from LeDeR. Okay, next slide. So this is just really a reminder. I'm hoping that everybody on the call will already know this, but it's always useful for a timely reminder that LeDeR is a service improvement programme. It's not a mortality review programme. It's about service improvement to improve care, reduce health inequalities and prevent premature mortality of people with learning disability and autistic people by looking at information about the health and social care support that they received. So it does it in three particular ways. One is it looks to deliver local service improvement, learning from reviews about what good quality care looked like and what areas of care and support require improvement. It's also about driving up local service improvement based on the themes that come from LeDeR reviews. So what do LeDeR reviews tell us? What are those themes? What do we need to do as a region, as a North East North Cumbria region? And what needs to happen nationally? What national changes are also required to be made? And it influences, what LeDeR should be doing is influencing both national and local service improvement and commissioning. That's really important that commissioners, people who have responsibility for organising, buying, and commissioning services, that they're really up to date with what LeDER's telling us so that commissioning can be massively impacted by the themes that come from LeDeR reviews. So LeDeR is for everybody. LeDER is about the lives and deaths of all people with learning disability and autistic people. For children aged between 4 and 17, they will have a child death review as against a LeDeR review. When you get the slides, all of the links that are in the slide are live links. So any links that you're particularly interested in, they will take you straight to more information should you want that. For adults with learning disability aged 18 and over, they will be entitled to a LeDeR review. And for people with a clinical diagnosis of autism, that's really important that for autistic people, they have to have that diagnosis of their autism. Aged 18 or over, they will also be entitled to a LeDeR review. So ICSs, that's the whole of the system, health and social care system, responsible for making sure that LeDeR reviews are completed and that the health, about the health and social care that people received before they died. So people with learning disability and autistic people. This enables the ICS, so the whole health and social care system, to identify good practice and understand what has worked well as understand what improvements in the provision of care that should be made and changed. So in the North East North Cumbria, we do a lot of work with a lot of the learning from LeDeR at scale across our entire health and social care system. But individual places, so for example, North Tyneside, North Tees, North Cumbria, they may identify particular issues that is about learning for that particular place or a particular service. That's fine as well. We would expect that individual places, individual services may also make change as a result of local learning. And as I said earlier, a LeDeR review is not a mortality review. It's not just about the last episode of care of the person before the person's death. It looks at the whole of the person's health and social care receipt of care and how that might have impacted on their overall health outcomes. But we'll hear a lot more about that today because Glenn's going to share with us what it looks like, what a LeDeR review actually looks like. So I'm going to take a pause there. And Julie, are there any questions at this point that need to be answered, or are we okay to continue to move on?
The only question in the chat was regarding the slides and can they be circulated more widely. So the slides will be shared after this this session. Their relevance more widely outside of the North East and North Cumbria. When we've gone through, you'll see that a lot of the discussion today is relevant to how we're going to work with LeDeR. So maybe less relevant if you're thinking of sharing them outside of the North East and North Cumbria.
We will put them on the Learning Disability Network website as well. So they are there if people want to see what we're doing here in the North East and North Cumbria. But feel free to share them if that's relevant. Okay. Amy, is this you or is this me?
This one's you, then me.
Okay, thank you. So the North East North Cumbria, one way of doing LeDeR. So we've been doing a lot of work across the summer because there's been a lot of change in our North East North Cumbria ICB. So in line with the policy, the National LeDeR policy, there's the link to remind you if you want to have a look at that. And because of the ICB 2.0 reorganisation, we have standardised how we're going to deliver LeDeR across the North East and North Cumbria. So it's now going to be delivered, it's being delivered as a one system approach across our whole geography. So it will happen in the same way in every place so that we'll have shared objectives and priorities that benefit the whole of our population. It enables us to be more efficient in how we deliver LeDeR. It will eliminate variation between places. And when Amy and I picked up this work in April this year and had a look at how LeDeR was being delivered, there was a huge amount of variation in how it was being delivered across the North East and North Cumbria. So this one way of working will eliminate that variation. It will also enable us to share resources equitably. Again, there was a lot of variation in that. Some places had dedicated LeDeR resources, most places didn't. So this enables us to share those resources fairly, and it will maximise the use of our very limited workforce. It will also be a much more improved way of being able to share intelligence across the whole of the system. So what do we learn from LeDeR? How are we going to share that across the entire North East North Cumbria geography? So it will enable us to have a shared vision. It will enable us to be integrated and accountable, and we will have governance across the whole of health and social care with widespread learning and improvement opportunities at scale. Over to you, Amy.
So LeDeR is a statutory function of the ICB and is accountable to NHS England for carrying out LeDeR. The SRO is David Perdue. The Director with Operational Responsibility is Kate O'Brien. The Director with Governance and Assurance Responsibility is Anne Fox. So if you think you have David, then you have Anne and Kate, and then below that you have Judith, who is the strategic lead for the whole programme. I support the coordination and business intelligence for LeDeR across the whole region. And we are accountable to the ICB Quality and Safety Committee and to the ICB Executive Board. So within the North East North Cumbria, we do have a centralised reviewer team, and that team consists of the senior reviewer, which is Kim Lawther. So Kim leads the reviewing team, she allocates reviews, provides support to the team, and carries out the reviews of the most complex cases. We also have a reviewer, Glenn Beatty, who's going to talk to you a bit later on in the webinar. Glenn carries out reviews and provides peer support to colleagues. Karen Heppel is also a reviewer who carries out reviews and provides peer support, and there is currently a reviewer vacancy within the team. We then have local area contacts, Heather McFarlane, so the local area contact will quality issue reviews, initial reviews, sign those off, and where appropriate, present focused reviews to the panel. We've also got Claire Alt, Jan Hemingway and Kate O'Brien who have the same role. All of the training for reviewers and LACs is provided by the national team, and on the platform there's also a number of resources available for them. So the one way of doing LeDeR means that the reviewing team carry out LeDeR reviews across the whole of the North East North Cumbria. Historically, reviews have happened at place and usually has been done on top of people's roles. That's no longer the case. It's a centralised reviewer team whose focus is to complete reviews. The team's made up of very experienced, skilled and knowledgeable LeDeR reviewers, and all completed reviews are quality assured and signed off by the LAC. The KPI requires that all reviews, initial and focused, should be completed within 6 months of the review being allocated to the reviewer. Notifications that someone has died to the national go to the national LeDeR platform, and that should be made as soon as possible after the death of the person. The reviewing team is now currently working chronologically to enable us to be able to meet the KPI, which we expect to be able to do by the end of March 2025, that should say, if not before. If not before then. So every person with a learning disability or autism who has their death notified to the LeDeR platform has an initial review of their health and social care. The reviewer talks to the person's family, their GP, and at least one other person who knew the person well. Glenn's going to go into this in a bit more detail shortly. The reviewer makes a judgment about whether a focused review needs to happen, and the national template is completed by the reviewer, and the LAC would quality issue the review to sign it off. For focused reviews, a focused review will be carried out if the reviewer finds areas of concern or things that they think we can learn from, if the person who died is from a Black, Asian or minority ethnic background, if the person is autistic with no learning disability, and that's at the recommendation of the national team. If the person had been under mental health or criminal justice restrictions at the time of their death or 5 years previously, they would also have a focused review. And it's also worth noting that a family member can request a focused review. The focused review looks at much more detail at the person's life and involves further discussions with many more people, reviewing more notes and really having a holistic look at the person's life and death. It's recommended by NHS England that 35% of all reviews should be focused. The national template is completed by the reviewer, quality assured by the LAC, and then that review is then presented to the North East North Cumbria LeDeR panel. This is just a little bit of a sort of diagram as to the process. So the notification of the death goes to central system. The central system will then decide, so if the person lives in the North East North Cumbria, that would then go to Kim, and Kim would allocate that review to one of the reviewer team because she understands the capacity, but she also understands where their experience lies. So Glenn does a lot of our autistic reviews because Glenn is an expert with experience. So the reviewer completes the initial review, speaks to the family, conversation with at least one other person, sends it to the LAC to be quality assured, and if the initial review is quality assured and agreed, then that review is completed and signed off. If there are concerns noted, significant learning, then the reviewer will recommend that the focused review is completed. The reviewer will complete the focused review, and then that review will be presented to the panel. Any questions?
Julie, have we got any questions in this section?
Yeah, so there's a few questions come into the chat. Let me just get down to the first one. Okay. Is it still the case that a LeDeR won't begin until the coroner concluded?
Yeah, we will come on to that. There are a number of statutory processes that sometimes need to happen for a person with learning disability or an autistic person, and they would generally happen before the LeDeR review takes place. So yes, if there was going to be a coroner's inquest, that would happen before the LeDeR review, and the LeDeR review will be paused until the coroner's inquest had completed. But we will come on to that in a little bit more detail very soon.
Will the webinar be able to recommend a process for learning from LeDeR to be fed into the acute trust assurance system?
Yes, we're going to ask you that towards the end of the webinar, because obviously we want to make sure that the whole system, health and social care, primary care, secondary care, whatever the support and services are that are supporting people with learning disability and autistic people, everybody needs to hear the learning from LeDeR and make sure that those messages are fed into existing systems and processes. So it's going to be a really important part of our webinar later on to understand, well, what do you need? How can we help provide that for you to then make it, so then all of you will be then responsible for making sure your local arrangements, systems, processes hear the learning from LeDeR.
And then what is the KPI that LeDeR team are needing to meet? And I took that off the slide where it says the 6 months completed within 6 months, but I didn't know if there was any other KPIs.
The other KPI is about focus reviews that Amy's just spoken about. So there is a KPI that all, there should be at least 35% of the reviews that are undertaken here are focused. And there's a 6-month KPI for completion of reviews from the point at which it's allocated.
Okay.
So once the review is allocated to the reviewer, then there's 6 months to complete it. And as long as we're complete within those 6 months, then we're compliant with the KPI. NHS England monitor the ICB on those targets.
Okay, a couple more. Is a focused review a multi-agency process?
Yes, it is. Glenn will come on to that when he talks about his role as a reviewer, but absolutely a focus review is definitely a multi-agency process.
And final one that I'm guessing you're going to talk about again is there a process for reviewers requesting access to notes from an acute hospital to complete a review in a timely way, ensuring all records, paper and digital, can be accessed?
Yeah, I mean, we haven't got a standardized operating procedure for that as yet, but we need one, and we are intending to develop one, because it has been quite problematic in some. We have got some examples where that has been quite problematic to for reviewers to access notes in a really timely way. So that's work that we are going to be doing as a whole system to try and iron out any of that variation.
Okay, and that's all for now.
Okay, thank you very much. I think we're over to you now, Glenn.
Okay, thanks, Judith. Judith, can you hear us okay? Because my internet just dropped out a second.
Yes, I can hear you loud and clear.
Oh, that's great. Thanks very much. Right, good morning, everybody. Thanks for joining. So as previously stated in the opening section, I'm one of the centralised LeDeR reviewer team. Could I have the next slide, please, Amy? Okay, so as my colleagues have quite outlined some of the process between the initial and sort of focused review, but generally as a day in the life of the reviewer, we are the main person who will undertake all aspects of completing the review. It's my colleague's responsibility to complete the national template and make sure that's of a good standard before we submit for assurance with the LAC. It is a bit of a lonely job. We do sort of work individually and come together as a team, and individually for things like supervision, sort of clinical discussions around cases, shared experiences, and that's the beauty of working in, albeit a small team, but we've all got a diverse sort of skill set and range of backgrounds and different experiences, which comes together, which when we blend all that together, gives us a good deep pool of knowledge in which we can use to support each other to complete reviews. I think there's sort of questions there around how do we gather records, and I think a LeDeR is a holistic view of somebody's life. So we do see, sadly, a lot of people with learning disability still die too young, but we do see a lot of cases where people do live to quite a good life and do live to sort of older age. A review I'm currently doing is for somebody within their 80s. Now, we're not going to go back fully in time to see conditions what they had maybe in the 1940s, things like that. But we do look at long-term health conditions, and to really establish what that long-term health condition had on somebody and how it was managed, we need to look at a wide variety of records. The starting point is always generally the GP, because that's usually got all records are usually fed into that system. But we look at which other services were involved in people's care. Did they have hospital-based care, both as an inpatient or an outpatient? With specialist involvement, we may want to look at the notes involved in that. Care home records, particularly where somebody lives, supported living, residential, nursing care. There's often daily notes kept on people's daily lives. That can be an important source. People may be involved in specialist learning disability services, or accessing mental health services with reasonable adjustments. So our colleague trusts of TUV and CNTW, we've got good work relationships there to try and get access to records as quick as possible. And also our local authority colleagues and looking at social care records. Care Act, as Judith said at the beginning, it is a review of health and social care across the integrated care system. So Care Act assessments can be really important in identifying the needs and the support needs what people may have had. Just to touch on other questions, we will look at other processes which have been taking place. Coroner's inquests, there's a great variation across the region. I've currently got some cases on hold which have been on hold for 2 years, and there's no sort of end in sight as to when that coroner's inquest will be heard. Equally, I'm going to attend a coroner's hearing on Monday, which has been held in Durham, and that's been sort of 6 months. So there's a real variation on how quick inquests are happening across the region. We will work with sort of our mental health trusts and our acute trusts, because if somebody dies within service, often mortality reviews are completed sort of post-death, and they have a lot of local learning in from that specific service. Equally, where there's more concerns and there may be potential for serious incidents, PSERF reviews, etc., we will work with our partners across the care system, integrated care system, to integrate the learning from their reviews within the LeDeR review. So what we do is we bring all this information together to formulate a summary of the long-term health and care needs of the person and how they were ultimately supported by services. It won't be a complete health record, but it gets the most relevant information, is the way we try to approach it. I think it's important to add, LeDeR is not just a desktop review of care. We try to tell the story of the person and what kind of life they had, and that looks at really how, what sort of upbringing did they have, how were they connected to their community, what sort of things did they like to do, what sort of things could they do independently, and what sort of things did they need support with, and really try to really tell the story of the person as an individual, the likes, the dislikes, how they identified themselves, and just little bits around their character and personality. And often talking to staff and talking to families, we get little anecdotes around people's lives and try to integrate them into the pen portrait in a sensitive but also kind of a funny way, where the person's character and personality shines through, so we can get an understanding of what they were, what they were like in their lives. We've heard some very uplifting stories in LeDeR, particularly in people who were maybe in long stay institutional care, when that was the model of care at the time, maybe spent 20-30 years in an institution and then moved out into their own homes, into the community, when part of the long stay institution closure programs. And there's one story which really touched me. I was a community nurse for a very, very brief period 15 years ago, and he hadn't really been, when he looked at the notes and I think back, he wasn't really given much hope of having a life in the community, and thought he'd be back in hospital, and actually sort of proved everyone wrong with real person-centered care. He lived a good 20 odd years in the community, died of a terminal illness which was unavoidable, but he went on a holiday to Spain every year, went to Benidorm with staff, and some of the stories I heard around just getting them on the plane and the first couple of times they went. So some of the issues, just the funny things, what happened when they were abroad. If you flip, as his sisters and his family told us, if you'd flip that back 20 years, you know, they never thought you'd see the day of them even going out in the community, never mind, you know, going on the plane to Benidorm. We've also heard some very sad stories as well, where people haven't had the care, maybe what they've needed and certainly what they've deserved. That can be down to a range of factors, usually lots of things like diagnostic overshadowing, where things can be put down to behaviours, where actually a person's maybe in real pain, and actually it's, you know, they're just acting out, they're displaying challenging behaviour. All them acronyms and sayings which we've chucked around for over the years, but actually somebody probably may have had a tumour, you know, sort of developing and were actually in real pain, and them investigatory needs have been just delayed, and it's resulted in sort of delays in care. I think some sad stories, what's coming through now, particularly through those who were in institutional care and then moved on into, you know, a lot of them moved together into new homes, and they've all lived together for years and years. Now they're getting to an older age. They're starting to die off now, sadly. And COVID had a really big impact, which ripped through, you know, long-established homes, and people passed away. And that's had a real impact on lives in homes. Staff teams who've been together for years, where people were almost extended professional families. And it's had a real change of life in a lot of these, you know, homes in the community. So there's a lot of sad side to LeDeR as well as some of the uplifting things what we do here. But to help tell the person's story, we want to speak to people who were involved, family members, health and social care professionals, carers, both paid and informal, and significant others involved in a person's life, because people with learning disabilities and autistic people do have and can have relationships with other people. So one story, I actually spoke to residents of a home about a person who died and included their views in how they missed that person's friendship, and just them being in the home on a daily basis, just to tell their story a little bit more. Sadly, we do see some safeguarding issues, so we don't always speak to family. There may be safeguarding issues. Family members may be still grieving, don't want to get involved, may have their own health issues, or just sadly, there's no family around anymore. So the skills and attributes of a LeDeR reviewer. To become a LeDeR reviewer, you have to have a registered qualification. So as a nurse, a social worker, a medical professional, allied health professional, and so on. Within the team, I'm a learning disability nurse by qualification, with a background in offender health, forensics, and nurse education. Kim, the senior reviewer, she's a paediatric nurse, you know, a long-standing senior manager in children's services. And Karen, my colleague, she's a registered adult nurse with a long history in sort of CHC, complex healthcare. So reviewers, we use our professional judgment and use a form of appreciative inquiry to formulate initial perspective and identify relevant learning. Our role, although we are one integrated care system, our role is to be sort of independent and a critical friend of organisations across the integrated care system. We use the reviews to identify good practice to share with the health and social care workforce, who will benefit from the information, ultimately to supply, you know, to provide services to people with learning disabilities and autistic people. And sadly, we identify poor practice or care that did not go as well as it should have. That needs to be improved. As my colleagues said earlier in the process, the first part is always initial review, unless some of them other key sort of priority groups, such as minoritized ethnic communities, autistic people, mental health, and criminal justice in the last 5 years, focused review. But most will be complete on the initial template, which involves pulling 1 or 2 records, speaking to somebody involved in the care, speaking to the family, and then getting that initial formulation. Then we make a recommendation for whether it's going to be a focused review or not, and the LAC will ultimately make that decision. So LAC, normally my initial reviews are discussed in supervision with Kim, the senior reviewer, and then the LAC will review that finally when it's submitted, and they may come back to us for further clarification, or they may sign that off. Anything in a focused review will go now to the new governance panel, which will be explained in a bit more depth. Next slide, please. So As a reviewer, to support learning from LeDeR, we will attend the new monthly North East and North Cumbria panels to share learning from reviews. We will also attend the newly formed learning interaction groups to share learning. We will support other investigatory processes such as safeguarding adult reviews. It'll be very rare when we get called to coroners, but there is a process within LeDeR where if we find significant concerns, we can refer to the coroner. Equally, I've referred several cases myself to safeguarding adult partnership boards with the recommendation that SARS are undertaken, and we've had quite a few, particularly in relation to autism, over the last couple of years. And we will also look to contribute to bespoke events such as learning and sharing events, lunch and learns, webinars such as today, and also integrate the ICB's LeDeR annual report. Happy to answer any questions if there's any in the chat, Julie.
There's one question in the chat. What happens if you identify not just poor practice, but also potentially criminal action? When do you involve the police?
Yeah, so again, as LeDeR reviewers, we're all accountable health and social care professionals. So if we've got the same safeguarding duties as anybody else, and I think if we do identify these concerns, we'd have to go through that. They'll usually come out very, very early. As soon as you've pulled a few notes in. I would like to think, given some of these things, when these notes come out, when somebody's died, these processes should already be in place. But if I found significant concerns, and I'm going to be escalating them straight away, and then we'd have to follow the process of escalating to safeguard and things like that. But I suppose if we had concerns in a home and it was picked out that somebody who was living was certainly immediately at risk, then we would again the safeguarding procedures which we should all be following, such as raising them concerns with police, etc., would be followed, I guess, straight away. Thankfully, we've never, certainly my last 4.5 years doing LeDeR, have I come across a case where I felt somebody living was at immediate risk. Hopefully that answers that question.
And then one of the question has just gone into the chat. LeDeR has identified sepsis ending in a death. Is there a particular theme in reviews?
So I think Judith's going to cover a bit more about the sharing of learning, but from focused review. So LeDeR nationally give us 10 sort of LeDeR themes, which align to learning from focused reviews. We certainly have previously, and I believe we probably will be in the future, is collect local learning. And sepsis continues to be one of the main causes of death, I believe, for people with learning disabilities. Although we're going to get some more information shortly around in the 2023 annual report. So I don't want to say too much on that one.
Thank you, Glenn. So just picking up on those other statutory processes, so occasionally there are other processes that have to be completed, like the coroner may get involved or a safeguarding adult review. Those processes should always happen first and before the LeDeR review is carried out. Occasionally, a LeDeR review can identify that a SAR, a safeguarding adult review, would be needed, but usually it's picked up the other way. If it takes longer than 6 months, and as Glenn's alluded to there, sometimes particularly the coroner process can take quite a long time, then the LeDeR review is paused. The child death review process reviews all of the deaths of children, all children aged between 4 and 17, and that's the primary review process for children with learning disability and autistic children. But the learning and results and the outcome of those reviews is shared with the LeDeR programme. And we're going to be doing some work with our colleagues in the child death review programme to strengthen the links between that process and the LeDeR process for the North East and North Cumbria. Next slide. Now, just to remind everybody, because occasionally this pops up again from time to time, there is a legal basis, a national legal basis for sharing information. So there is a lot more information if you want to understand that in more detail, there's a link on the bottom of this slide. But the national programme submitted a request under Regulation 5 of the Health Service in 2002 to process confidential patient information without consent. Approval was received from the Secretary of State for Health and Social Care. So that legal basis allows identifiable information about deceased people with a learning disability and autistic people to be shared with the LeDeR programme. We know occasionally, when the reviewers contact general practice and other providers, there can be some reluctance about sharing information because of GDPR. So what we wanted to do today was just remind everybody that there is a legal basis for sharing information as part of the LeDeR process. Okay, over to Kathy.
Hi everyone. For those who weren't here when we made our introductions, my name's Kathy Peterson. I'm a GP partner. I was a clinical lead in Northumberland and actually did LeDeR reviews myself, and I'm now strategic clinical lead for North East North Cumbria for learning disability, neurodivergence and mental health. So I want to talk to you about the panel arrangements. LeDeR reviews will come to us in a new LeDeR panel, which is being established in October 24, and we will meet monthly. It'll be chaired by me, and we will also have experts with lived experience from the Stop People Dying Too Young to, start again, put my teeth in, Stop People Dying Too Soon, and the Cumbria Confirm and Challenge group, who will be members in the group along with other key stakeholders from health and social care. And these people will need to have responsibility for the quality of services, and will be able to take those actions to improve services forward. So we'll sit with the redacted, focused reviews and decide on what actions to take. And we'll have smart objectives, thinking about what also will be the North East North Cumbria strategic plans. This panel will sign off the focused reviews, and the actions and objectives will be taken forward into the next panel, which is the Learning into Action group. Next slide, please. So the Learning into Action group is being established from November 24. So by then we will have had 2 panels, and this will meet bi-monthly, chaired by the lovely Judith. And we again will have the lived experience from Stop People Dying Too Soon and the Cumbria Confirm and Challenge. I still can't say that. So again, we will have key stakeholders from health and social care. And again, they will need to have responsibility for quality and action to improve services. So this group will review all of the panel's smart objectives and agree how to implement them so that we reduce health inequalities and stop people dying too young in North East North Cumbria. It will be action orientated, and members will take responsibility for implementation. The members will decide and make plans to make sure that the learning is shared widely and systematically. Now that is a challenge, getting that shared, but we have a number of methods in which we're going to do that, and Judith is going to talk to them later. Critically, the Learning into Action group will be calling the health and care system to action, so we will be having some assurance. So that all of the panel and the Learning from Action review will be then taken to the revised North East North Cumbria LeDeR governance group. And the existing governance group is going to be fully revised. It will continue to be chaired by Anne Fox and will meet quarterly starting in January 25. Again, we'll have experts by experience and key stakeholders to take things forward, but it will provide that critical oversight of LeDeR performance, learning into action and improvement, and it will be linked, and we will report directly into the ICB quality assurance and patient safety. It will also be responsible for the oversight of the completion of the North East North Cumbria LeDeR annual report, and obviously all our data goes to the LeDeR national report. So this is where our assurance is happening. Any questions? I noticed, Julie, there's a couple of questions in the chat which I'm happy to talk to. The first one is by Anita Winter. Deaths by suicide, obviously they have a LeDeR process, but deaths by suspected suicide go also through our suicide prevention arm of the ICB mental health, learning disability and autism pathway, and they have a number of actions where we look at that. That would also go through a coroner review. There is also a process with the ICB to support family members and other people affected due to bereavement, due to suicide. Does that answer your question, Anita?
There's a few more questions in the chat, in the Q&A as well.
So moving on to Simon's question, we know that a lot of people with a learning disability die in hospital and go into hospital, and people don't understand either that they have a learning disability, because we know lots of our patients don't have a learning disability or they're autism diagnosed. We are rolling out in North East North Cumbria Oliver McGowan training for all health and social care. Some of the hospital trusts have their own training. So we're also in discussion with all of the hospital trusts about what's happening in each trust around learning disability, reasonable adjustments. And as you know, we're rolling out the reasonable adjustment digital flag across the region.
So there's a few more questions. I don't know if you want me to run through them from the Q&A.
Yes,
So,
please. Yeah.
Will there still be access locally to LeDeR funding for related training for care providers?
So I'll pick that one up. There isn't any LeDeR funding that comes into the ICB in the way that there has previously from NHS England. However, LeDeR features as a major part of the Oliver McGowan mandatory training that is being rolled out across the North East and North Cumbria. So and that's for all health and social care staff. We can, when we pull all of this together at the end, we can also give you the link to where there are places available now for Tier 1 training, and then there will be some places for NHS staff for Tier 2 training imminently, and then there will be places for social care staff once the NHS England nationally have issued some funds for social care for rolling out the training. So we can provide you some additional information about how to access the Oliver McGowan training now, should that be something that you would like to do.
Okay, so are we assured that the CDR process reviews the child or young person in the same way as LeDeR, or is this the focus, the change it?
Yeah.
Or is this
I think
the focus that
that
changes the way?
Yeah, I think we need to understand that process in a lot more detail, Helga. My understanding is it's not, the child death review process is not the same as the LeDeR process, but strengthening the relationship between child death review process and LeDeR will enable us to understand how the focus of each other. So I couldn't say confidently that I'm assured at the moment, but that's work that we're going to be doing in the coming weeks.
Have you got time for a couple more?
Yep.
Okay, is there a reason why SARS needs to happen first? We tried previously to run LeDeR and SARS simultaneously, so the family have one point of contact for both reviews, and that was Ginna Hunwood.
Yeah, I mean that's okay. If at a local system you can do that, then fine. It makes perfect sense, doesn't it, for the family to only have to be involved in one go, in one process. Where that doesn't happen locally, then the SAR should generally go first and then the LeDeR review. But again, you know, you can determine that locally. I guess what the important message is that usually the LeDeR review doesn't come first. It can in occasions, because as I said earlier, the LeDeR review on occasions can identify that actually a SAR should have taken place. But generally the SAR will come first, then LeDeR. But if locally you can do it together, then fine.
Quick question, how many LeDeR reviewers do we have whole-time equivalent?
Yeah, I can't pull it off the top of my head, so we'll provide that information after the webinar.
And final one for the moment, how do you report into health and wellbeing boards for the SC involvement?
Social care involvement. I mean, that's a really important question, and I think that's something that we need to get much better at. And I'll pick that up in the communication part towards the end of the webinar. because really we want to be advised by yourselves as to how we do that, rather than us say this is how we think we should do it. We need to know what will work for health and social care, for health and wellbeing boards to receive that information. Thanks, Julie. Okay, moving on. Okay, so what we thought is we would just give you a flavour of what's in the ICB's LeDeR annual report for 2023. So it will be published next week after it's been signed off by the Executive Board on the 1st of October. It'll be published on the ICB's website. It'll also go onto the Learning Disability Network's website. So the annual report is for 2023. So from January to December 2023. The reason that that timeline has changed, so previously we would do like 22, 23, April to March. The reason that that's changed is that NHS England nationally have also changed its reporting schedule. So we're falling in line with what NHS England have done. So in 2023, there were 257 notifications made to the North East North Cumbria on the LeDeR platform. 216 reviews were carried out. 190 of those were initial, 26 were focused. 208 of those reviews were about people with learning disability who had died during 2023, and 8 were about autistic people who had died in 2023. 41 reviews weren't completed within the timescale, but are being completed now. And once they are completed, we'll write an addendum to the annual report with the learning and analysis from those additional 41 reviews. This is just a summary of what we've learned in the report that was written for 2023. So the grey is about people with learning disability, the peach is about autistic people. So what did people die from? People with a learning disability. So the most of the deaths were attributed to pneumonia and aspiration pneumonia. 23 were about issues relating to the heart, and 22 were due to respiratory conditions. 19 were about issues relating to organs in the body, and 18 from cancer. And then you can see the numbers get lower and lower in relation to other causes of death. These are the main causes of death. A lot of people obviously have a number of comorbidities, but this is what's been recorded on their death certificate as the main cause of death. The peach part is the summary of the learning from the deaths of autistic people, but the number you can see is extraordinarily and worryingly very low. Of the 8 people who were reported on the LeDeR platform, 5 were men, 3 were women. You can see the age profile there as well. So albeit the numbers are very small, the most were between 31 and 40. You can see there as well where people died. And then you can see on the bottom of that graphic what people died from. So 3 were from complications of drug misuse, 1 from cancer, 1 from liver disease, 1 was a SUDEP, 1 was suicide, and 1 was a brain abscess. What I will say about, we're going to come on to what we're going to be doing about the fact that the notifications for people with learning disability as well as autistic people, we think are very underreported. But what we do learn from the deaths of autistic people is generally the reasons that people die are quite different from the reasons why people with learning disability die. But we need much, much bigger numbers to be able to properly understand and act on that. Okay, next slide, Amy, please. So there is a massive variation between the places in the North East and North Cumbria of how many deaths are notified onto the system. So we will be doing work in the coming weeks and months about just raising awareness again about LeDeR. This is kind of the start of that work. We are absolutely certain that they are hugely underreported across the whole of the programme. There is significant underreporting of autistic people, and there's massive underreporting of people from minoritised ethnic communities. We're not achieving the KPI for focus reviews, 35%, so we've got some plans to address that. That will include, as well as whether one of the reviewers says, after an initial review, there's more learning, so it should be focused. And then, of course, those groups of people that we've already discussed that automatically are focused, we are also going to introduce some additional measures for including a focus review, particularly linked to the most common causes of death. So that's work that we'll be doing across the winter to think about how we will kind of promote that so that we can understand in much greater detail why people are continuing to die early of things that potentially could have been avoided from the most common causes of death: pneumonia, aspiration pneumonia, respiratory disease, heart disease, etc. We also have learned that there are some concerns about the quality of care. So the grading of care is massively subjective as part of a LeDeR review, and it only takes place as part of a focus review. Grading of care is not included in an initial review. But that said, of the focus reviews that were undertaken in 2023, we have noted that there are some concerns about the quality of care that people were given, and there's a particular scale. You'll see when you see the full report, there's a particular scale of that grade of care, from very, very good care to very, very poor care. Next slide, please, Amy. So what we're doing, well, the one way of doing LeDeR across North East North Cumbria is a big part of what we're doing to try and eradicate and remove all of the variation that's been in place previously. We've got the centralised reviewing team. That's a big part of improving things across the North East North Cumbria. The new arrangements that Kathy's just talked us through, the panel learning into action and the refresh governance group, will be about addressing the learning points. And then we have also created some prioritised action plans, particularly to increase awareness across North East North Cumbria in terms of the whole of the LeDeR programme, but with real focus on autistic people are included in this programme now, have been since 2021. Previous to that, when LeDeR started in 2017, it was only about people with learning disability, but autistic people were added in 2021. And of course, very, very low reporting on people from minoritized ethnic backgrounds. So we'll be working with the EDI lead in the North East and North Cumbria to make much stronger connections with minoritized ethnic communities across North East North Cumbria to address that underreporting. I've already talked about, we will have some additional guidance in the North East North Cumbria about focus reviews linked to the main causes of death. And all of the learning from LeDeR, almost all of the learning, is hugely and fully aligned to the Learning Disability Network Health Inequality Programme, which is where a lot of the improvement work across the whole of the North East and North Cumbria is delivered, working with others across our patch. Next slide, please, Amy. Oh, that's it. Q&A. So what questions have we got in this section, Julie?
So there's one question come in just to say, have you specific data about children and young people?
The answer is no, not as yet, but part of improving the connection between the Children's Review Programme and LeDeR, we will develop a way to be able to have that data as well.
And then just a comment from Anita Winter to say, in South Yorkshire, we grade both initial and focus reviews to help us understand the quality and also pull off the learning. There is always some level of learning.
Yeah, I mean, I might pick up a conversation with you about that, Anita, outside of here. I guess it's about capacity of our team. It's a very small team, and it's a very huge geography. So yeah, I mean, the more information we can get in an initial review, the better, but really mindful that initial reviews are initial reviews, and definitely previously initial reviews were almost being carried out as focus reviews, although still under the kind of the label of an initial review. And there is just no capacity or requirement in the policy to do that, but I completely take your point that the more information we can get, the more learning we can get is only going to improve things. So I'll pick up a conversation outside of here, Anita, if that's okay.
And then Anthony said, what intelligence sources are being used to evidence, triangulate underreporting of deaths into LeDeR?
I'm not sure I understand the question. Do you mean where do we get all of the information from? If that's the case, then Glenn's talked us through that. It's mainly through talking to some people who knew the person well, and including health and social care professionals, families, and reviewing notes. Kathy, you put your hand up?
I was just going to say, I think the question is more about how do we know that there's under-reporting of deaths?
Oh, I beg your pardon. I've read it. I've misread it. I'll go to Kathy and then Glenn.
Yeah, thank you for your question, Anthony. We have had long discussions about this. We know that about 75% of our expected prevalence of learning disability are not known to us, so we make big assumptions about underreporting from a knowledge about whether someone has autism or learning disability. But we also need to think very clearly about how we make sure we are collecting all of the notifications that we need to. Now, obviously, we encourage, in response to Lucy's question, it's everybody's responsibility to submit to LeDeR, and we would much rather have more than one notification than none. But we need to make sure that all hospitals, trusts, that being mental health and physical health, all social care and all primary care particularly, are aware of LeDeR. And we have tried to think about systems within primary care to ensure that someone who has a documented learning disability gets a LeDeR review. It's still, there's this potential for user forgetting to notify. So it's a really good question, and I think probably lots of work to be done on that. We don't know what we don't know about that. Thank you.
Thanks, Kathy. Glenn?
I think Kathy covered most of them points, really, what I was going to say, but I think it's just obviously still, with the places all just coming together across a massive footprint and trying to get that one-way approach, I think there's probably still a little bit more to do locally.
Yeah.
But certainly some places have LeDeR built in, in their, so when a person dies, like the aftercare work, what they do. So and I'm working with different providers now to make sure that don't try and uprate the number of autistic persons notifications coming through. But again, it's going back to that original point about clinical diagnosis, and actually, do people have the right diagnosis on clinical systems as well? So there's still some work to do on that, but I think we're definitely heading in the right direction.
Yeah, thanks, Glenn. I can see Julie's just put in the chat as well about people who are on the waiting list, given that they're very long, particularly for autism diagnosis. We've never properly considered that, Julie. So I think that is something that we'll take away as an action as the LeDeR kind of leads for the North East North Cumbria, and we'll have a conversation and make a decision about that, because it's a really, really important point. Kathy, your hand's up.
Yeah, and I think the other important point is that LeDeR did specify that it was an NHS diagnosis of autism, not a private one, which will be problematic going forward because of the need for other kinds of routes to diagnosis. So I think we probably need to take a pragmatic view rather than a very definite view. I agree about the waiting lists. I just wanted to come on just quickly on another point. In answer to Amanda's question, yes, we have been talking to the medical examiners, and we think the medical examiner role across primary and secondary care will really help pin that down about people who definitely have a learning disability and or autism. Will be notified because of that interaction, and we have been doing that. But I just wanted to make sure that Anita had seen the comment I made around the suicide and autistic people. Thanks.
Thanks, Kathy. Okay, next slide, please, Amy. Just keeping an eye on the time. So I just wanted to remind everybody, you will know this, but LeDeR is everybody's business. So whilst we've got a team and we've got some people who are really doing a lot of work on LeDeR, it actually is everybody's business. Anybody can notify a death onto the platform. You can do it via the website. There's the live link. We've also now got a QR code in the North East North Cumbria, and we'll be publicising that really far and wide as well. The system, the national platform is clever enough to identify duplicate notifications. So we'd rather a death was notified multiple times rather than people thinking, well, somebody else has done it or it's somebody else's job to do that. If you know it, then notify it. Don't worry about there being duplications because the system picks up that it's the same person. So this was just kind of a timely reminder for everybody. LeDeR is everybody's business. Next slide, please. So I wanted to come on to communication and sharing learning. There's been questions already in the chat. So the first thing to say is we've already got loads and loads of resources about supporting health and social care to tackle health inequalities for people with learning disability and autistic people. Everything that is made in North East North Cumbria sits on the network's website, and there's a link there. And there's just some examples of what I've just put in there is the reasonable adjustment campaign. You know, just helping people understand what reasonable adjustments are. We know that the reasonable adjustment digital flag is coming. That's just one bit of work that can really make a difference in supporting health inequalities and reducing premature mortality. So the first thing to say is there's already loads of stuff there. The second point on this slide just says, as well as the all of those resources, huge health inequalities program that the network is responsible for. There's also on the network's website is where all of the LeDeR information sits as well. It is being continually updated, and going forward, it will play a huge role in disseminating learning and also sharing best practice examples. So if you've not been used to regularly checking on the network's website in relation to either of those things, I'm going to encourage you to do that. The third point on this slide is that we are very, very aware that sharing learning from LeDeR and communication needs to be massively improved across the North East and North Cumbria. So we are developing a communication plan. We've got the ICB comms team are going to support us with all of that. But what we need from you is tell us what you need. How do you want to hear? I mean, we already send out, as the Learning Disability Network, we send out loads of information, we send out a regular bulletin, etc., etc. But we're not always convinced it gets to the right places. So what we want you to do today, you know, have a little think, you don't have to do it now, go in, think about it. What would work for you and your team to hear about learning? So for example, we can run a monthly one of these. You know, we can do some analysis and some thematic analysis and do some really focused webinars and tell you about what we're learning kind of month on month as reviews are being completed. We'll be really happy to do that. We can continue to do to send out bulletins and share what we're learning sort of on a very regular basis. We will have next year, there will be a big learning and sharing event, like conference, a LeDeR conference. We haven't had one of those for a little while now. So yeah, we want you to tell us. That's kind of how you are hearing the learning. The reporting of LeDeR, as somebody put in the chat earlier about like to health and wellbeing boards, you also need to advise us about that. I mean, Amy and I could spend all of our time just going around, you know, every health and wellbeing board across North East and North Cumbria, and we would get nothing else done. We need to find really smart ways of getting information out, and we need people like yourselves who are interested. You're interested because you've come on the call to help share that information out as well. So it's communication and sharing learning is also everybody's business. So yeah, please put in the chat, if you've got any ideas, any ways that you know works really well, please tell us. We would be really happy to deliver what it is that you need. Next slide, please, Amy. So yeah, we want to hear from you. So please get in touch about a number of things. So the first thing, you've heard from Kathy about all of the new groups that have been established. The panel monthly, Learning into Action bi-monthly, the assurance panel, the assurance group quarterly. The reason for that monthly, bi-monthly and quarterly is that the Learning into Action group will meet after there has been 2 panels, so that it has a lot of stuff to be working on, and then the governance group will meet after the panel and the Learning into Action group We'll meet quarterly so that it's got a quarter worth of information to be assured about. So that's why it's in those kind of timeframes. So we want to hear from people who have responsibility for the quality of health or social care services, and you have responsibility for improving them. So are you in a role where you can have a huge amount of influence on improving health and social care across the North East and North Cumbria? We want to hear from you if you're interested. We also want to hear from you if you've got those level of responsibilities and you're keen and willing to share, kind of to represent a bigger group. So to go back to your organisation and share with others. We want to hear from you about that as well, because we know we're already, we've had loads of questions across the summer about can I be on the panel? Can I be in the Learning Interaction Group? We can't have everybody, obviously, and we need it to be of the size where it can function properly and do the work, really important work that it's going to be required to do. So we haven't yet worked out who's going to be in those groups because we wanted to have this webinar first. So please, if it's not you, but there is somebody in your organisation you think it should be, have a conversation and come back to us. We've now got one email address for LeDeR and would encourage you, please use that going forward. Amy and I and others will monitor that inbox, but it will just mean that everything about LeDeR will come into one place. So make a note of that email address on the bottom, nencicb.leader@nhs.net. And as soon as we've kind of very quickly going to be working on the finalising the membership and the terms of reference, ready for the panel, Learning Interaction and the governance group to be operational from next month. Next slide, please. Oh, there we are. We'll come to the end. So I'll pick up any last questions. I know there's been loads of popping up on my screen. I bet there has on everybody else's. So I know Juliet had to leave. So Amy, can I just ask you to just pull off any final questions, comments that have been made, please?
Just bear with me.
Anita, I'm just reading there that in South Yorkshire you produce a quarterly report. Yeah, we're kind of thinking in that space about that's how we will be able to report in a manageable way. Any other questions? I'll have a little quick look myself as well. So Julie has said we could use some of our methods. We are happy to do reports, updates to health and wellbeing boards on your behalf. Yeah, we'd be really happy to do that. That seems that it would work really well. Using your local newsletters for provider forums, great. Yeah, that would be great. All of that. Yeah, we'd get all of that written into our comms plan and have a proper systematic way of regularly being able to share information with yourselves so that you can update your local health and wellbeing boards. That would be great.
So in the Q&A, there's lots of comments about webinars, monthly bulletins.
Yeah.
There's no specific questions.
Okay. Great, thank you. Webinars, really happy to do that. Now we've done this one, that'd be great. Anything in the chat as well, Amy? We'll just have a quick look there. I'm just quickly looking as well. I know people are having to leave, which is fine. Local delivery teams and ICBs are now smaller. So can you advise how you plan it to update? Yeah. Yeah, I mean, that's a really important point, Mandy, that you're making, and recognise that completely. So I'm having conversation with the local delivery team directors, all of them for across the North East North Cumbria, to kind of agree the format by which we'll be reporting on LeDeR or sharing learning from LeDeR into the local delivery teams. Again, we need to find a systematic way of doing that so that we're not having to do it for individually for each team. But I completely take your point. They are smaller, much smaller. So that's why I'm having a conversation with the directors to work out what's going to be the best way going forward. Short videos, recorded webinars. Yeah, happy to do that. I can't see anything else, Amy, that's kind of leaping out to me. I don't know whether or not you can.
No, that's everything, Judith. But obviously I will go through it after the webinar.
Okay, thank you. So, thank you everybody for coming. I hope you have found it useful. We were really mindful when we were kind of planning what we were going to talk about, that it was going to be a massive information dump. But we also wanted to assure you that although leaders might feel as if it's gone a little bit quiet across the northeast and North Cumbria because it's not being delivered at place in the way that it was. We wanted to show you actually it's anything but quiet. There's been a huge amount that's been going on, and obviously loads of work having to be done to get us from how it was being delivered to how it's being delivered now. And Glenn said it really well, you know, we're still in the very early days of this one way of doing LeDeR, and we are going to come across bumps in the road, and there will be things that we haven't thought about that that we'll need to think about. So please stay in touch. If you've got a great idea, you know, all ideas are good. If you've got a great idea, get in touch with use the email address that I showed earlier, and you know, just tell us. Tell us what you need. Tell us how you want to be told. You know, and give us advice if there's ways that you think we can be doing this better, differently. You know, we're really happy to hear it. So that has brought us to the end of our webinar. I hope you have found it useful. This is just the start. You know, we're not going to go into a big vacuum again, you know, for the next few months. We will be around all of the time and sharing learning all of the time. And as I say, from after the 1st of October, the annual report will be published on the ICB website. It'll go into the bulletin next week for the whole of the ICS, Health and Social Care, to give you the link so that you can see it. Please read it. Please share it with others. I think that's it. So we've finished about 5 minutes early, which is always a good thing. So thank you for your attendance, and keep in touch, and hopefully we'll be all together again soon. Thank you, everybody. Have a good rest of the day.
Thank you.
Bye.
Bye.
Thanks, Glenn. See you soon.
Yeah, thanks, Kathy. I was just wondering if we're staying on, but I guess
yeah, it doesn't look like it.
Look like they've gone now. So
I just wanted to thank you for your help with the Adult Not Brought work. I hope you've seen the output of it. Have you?
No, sort of. No, I haven't had many cases. I think, to be fair, where there's people falling through the net.
It doesn't get asked now. It did just before they changed it. It did get asked, didn't it? It was about what was not brought, but it doesn't appear to be asked anymore. But
I think we use it as as a reviewing team. We use it as a key line of inquiry. So
great,
because I mean, thankfully, every case I seem to have at the minute is people are actually being brought to appointments and attending regular. But obviously, when we start getting a few where there's DNA is missed, we'll use that as a key line of inquiry.
Yeah, no, that's great. I wasn't sure whether have you actually seen the work. I know you're part of the steering group. Did you see the final outputs of it?
I've seen, the publicity materials. The train looked decent when I saw it earlier this year. I think it was. Just every day merges into one at the minute.
Oh, I know. Yeah, no, I get it. Absolutely. Thanks for your help. That's really great. See you later.
No worries. Thanks. See you, Kathy.
Bye.
Bye.